We chose to focus on telehealth in third world countries. In 2009, the World Health Organization counted 104 distinct peer-reviewed definitions of the concept of telemedicine. However, they took all these definitions and came up with one broad definition: the delivery of health services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities, is the definition that they came up with and agreed upon for telemedicine. Why do we need telemedicine? Well, there's places in the world that have a very low physician to population ratio. So, if we can bring more physicians into those communities by telemedicine, then those patients will have a better opportunity to be cared for. There's also places that don't have any specialists in the world. So imagine needing a neurologist or a cardiologist and not having one for miles away. Having access to telemedicine means that you can get the care that you need in the comfort of your own community. There's places that do have health centers or first aid centers, most often remote locations, who don't have access to any type of specialist, sometimes even any type of doctor. And those places can use telemedicine to get more in-depth care than they would at a first aid center. And if you think about what's going on in our world right now, telemedicine is really great for pandemic communication with constant updates by the WHO and by the CDC. Doctors in America and other first world countries can give recommendations to countries that don't have the same type of research or the same type of communication possibilities or access to healthcare providers that we have. Services that telemedicine offers are specialist monitoring and network opportunities. Typically, in order to have access to a specialist, one is going to need to have a primary care provider and access to audio and visual communication. Speaking with a specialist can help to get a diagnosis, treatment plan, prescription, or just advice from someone who's more prepared in the field than a general practitioner. Below on the right side is a graph of just some of the few specialties in telehealth, including radiology, pathology, dermatology, and psychiatry, where they're at and kind of where they're growing to and what percent of the market that they take up. Telemedicine makes it possible for people to have health monitoring solutions at home and have that information sent to a monitoring station for interpretation by a doctor or other healthcare provider. Things that people can monitor at home include vital signs like blood pressure with a blood pressure cuff, glucose monitoring, getting an ECG, having their weight recorded daily, or telemetry. And what this does is it really takes a big time commitment off of visiting nurses who would otherwise have to go to those communities or those specific houses or see certain patients on a daily, weekly, monthly basis just for monitoring purposes. It takes that weight off of their plate and gives more of their time to people in the community who need hands-on care. Telemedicine gives people the opportunity to network throughout the entire globe. So things like group-based education classes and seminars can be done in one country and heard around the world. Mentoring can be done from any type of healthcare provider or specialist to anyone in any country. There's online discussion groups that can create a space for people who are going through something maybe more difficult with their health or need some answers. And then there's also peer-to-peer communication, which I think is one of the biggest benefits of telemedicine, is being able to have a doctor or a team of providers connect you with people who have been through what you're going through or can share with you what's worked for them.
So how connected are we?
There's currently an internet connection struggle in Africa, preventing many countries and people from having access to telemedicine. Part of that is the fact that only 6.7% of households in Africa have internet access at home, and only 16.3% of people use the internet in general. There's also inadequate infrastructure in Africa and high costs associated with obtaining telemedicine. There's a limited awareness of telemedicine by healthcare workers and the patient community, making changes to getting telemedicine not a top priority. It's also not a top priority for the government. However, Kenya's Ministry of Health, James Macharia, said, "I urge all stakeholders and country governments to invest in telemedicine as a way of bringing specialized services closer to the rural poor," proving that there are some people campaigning for more access to telemedic health in Africa. Who's leading the race in South America? Chile is currently the leader in telemedicine adoption in South America, with 68% of the country's hospitals offering some sort of this technology. Next up is Uruguay, with 54% of an adoption rate. And in 2017 to 2018, there was a 10% increase in hospitals offering some sort of telemedicine adoption. The only other country that had anywhere close to that sort of rise in just 1 year was Peru, with a 6% increase. Guatemala is number 3 in telemedicine adoption in South America, with 45% of its hospitals offering some sort of technology. Larger markets like Argentina only have a 26% adoption rate of telemedicine. The WHO set out clear standards for Africa to achieve by 2030 in relation to telemedicine. They are working to have at least a 50% reduction in inequalities and access to a health worker, because so many people in Africa don't have access to any form of a health worker. They're looking for at least an 80% course completion rate in medical, nursing, and allied health professional training institutions. And this is because they have many people starting in these types of schools who don't finish. And part of their resources for getting people to complete these schools are offering more benefits for people who work in the healthcare industry. They're hoping to have at least 50% of their countries establish accreditation mechanisms for health training institutions. Machiato Moiti, the WHO Regional Director for Africa, said better incentives to retrain staff and also attract back workers from the diaspora should be put in place, as well as the urge of appropriate ICT, which is information and communication technology, tools such as e-learning, electronic health records, and telemedicine to improve education and efficiency of health service delivery. He said this in regards to a question about how to obtain better health services in rural communities. The lack of legislation in Latin America protecting patients' confidentiality and privacy in regards to their medical records is a huge barrier to more of Latin American countries adopting telemedicine. It's interesting to note that there's a faster rate of growth in telemedicine adoption in public hospitals versus private hospitals. And it's possible that down the line we might see private hospitals go away completely or significantly reduce their services as more people turn to public hospitals because they have more access to specialists and mentoring and telemedicine in general around the world. We wanted to see what the holdup was with hospitals and healthcare providers that's preventing them from adopting telemedicine.
So, policies in general is a huge barrier for telemedicine to flourish, for smooth functioning, and for the continuing development of any system. We need to have a definite policy and procedure at a state and national level for everyone. These defined rules, regulations, and procedures and protocols would be necessary for telemedicine system to run smoothly and safely. On top of that, many practitioners feel uncomfortable in the fear of malpractice related legal issues because there are not definite policies in place. Furthermore, there is a lack of established international framework on telemedicine, and also there is little consensus or understanding on uniform international standards for telemedicine. state, country, and international borders. So there should be at least a common international understanding on this issue. We should have standardization of both hardware and software, as well as guidelines for practice. Ultimately, this would help telemedicine as a whole. As with any business, when you're implementing a new program, um, funding is the utmost importance. For establishing a telemedicine unit, it needs a lot of financial investment. This becomes more difficult for developing countries to allocate a really big budget for an investment like in telemedicine. Going further to establish this telemedicine unit, it requires purchasing the equipment for both the provider and the consumer's end. And we can go down a rabbit hole of all the other costs like electricity bills, the support of internet, the salary of the staff, and just recurring costs. And we have to think about training programs and training the communities of how to use such technologies. The integration of telehealth requires a solid framework of interoperability between systems for the technology to be up to speed and ethical for telehealth practices. Because the lack of collaboration between the stakeholders at every level of the healthcare delivery system could and likely will create a bottleneck in the development of telemedicine. So let's talk about COVID. No better time to start telehealth is during a novel pandemic. And Mauricio Cerda would agree. They say managing patients at home is a brilliant thing, and this would then decrease the transmission by protecting patients, protecting the public, and ultimately protecting the people that work in the field. MSF, otherwise known as Doctors Without Borders, is a corporation, but more importantly, they are an international independent medical humanitarian organization. And they specialize in crises where supplies are really low, where they are working in third world countries and in sometimes war scenes. So in Italy, they went to help them in Lombardy, and they implemented a telemedicine program, which was a video conference that assisted people that had to be under isolation, since everyone was under isolation.